Hi, Dr. Ghabili.
Good morning, Darryl. How are you?
I'm good, and I hope you are too. And I and all of our Malecare community are grateful for your time today and for being part of our conference. So, for those who don't know who you are, could you tell us what you do and where you do it?
Absolutely. Thank you so much for having me first. My name is Kamyar Ghabili. I'm a physician. I'm doing research at Yale School of Medicine in the mostly on the radiology side of the medicine. And I'm happy to answer your questions today.
Yeah, with COVID, everybody's wondering where diseases start. And it occurred to us, like, where did prostate cancer start?
So the prostate gland, which is the part of the body, was not well known until 16th century. So it is although interesting to know that most of the organs in the body were recognized and were known to the people before that time in the history, but prostate, because of its location in the body, was not really visible and palpable to people. So it was first known in the 17th or 16th to 17th century. And the prostate cancer itself was first reported around 80th century in England by a pathologist in London. And so there is a huge gap between the history and in the history until the first report of the prostate cancer.
So prior to 16th century, no one who opened up a body noticed that there was this thing there around the urethra and wanted to come up with a name for it?
No, it seems that even in the operating room, the prostate gland is not well rounded and well circumcised by so that's why just by normal vision without microscope or without very high yield technology, it's somehow difficult and impossible for the old people and ancient people.
What did they think the prostate was there for?
So they were not really sure at the beginning. So our knowledge about prostate is maybe 200 years or 100 years. But in those times, they were thinking of not necessarily they were not sure about its function in the body. They knew that it was separate from urinary bladder. It is around the urethra.
So by not knowing what it was for, they didn't know when problems would be incited by it or that it would have something called cancer in it. Now,
Yeah, presumably yes.
yeah, but cancer tumors were known for much longer prior to like the 16th century, right?
Yes, other cancers. Yes, we have reports from published reports from skeletal remains and from the past that cancer generally is an old world disease. And because for cancer of other organs like breast or some other organs, as people can see that, they can see the change in the color of the skin, or there is a bump on the body, so they could figure out that there is something going on. But for prostate, it is inside the body, not really, as I said, not really visible.
What year do you think somebody first noticed there might be a bump or a lump in a prostate?
That's a good question. I'm not sure about that, but I can tell you that it was in the 18th century that they found in the operating room that there is a bump in the prostate, and they looked at it under microscope and they saw that those cells are different from normal, like, surrounding cells.
Yeah, and it might be a surprise to many listeners that people were doing surgery in the 1700s. And I mean, most people would die from infection, I imagine, but you know, days or weeks after. But some of those surgeries were quite successful and remarkable for the time. Yeah.
Absolutely, yeah. They were doing surgeries, and they were just doing surgeries just based on their very limited resources.
Yeah. The idea of people knowing about cancer, when do you think, what time period or historical period do you think generally worldwide, or at least in Europe perhaps, people understood there's this disease called cancer?
If you're talking about the prostate cancer
Yeah.
specifically, it is, I would say, 100 years ago, that maybe 100 or more than 100 years ago, that we know that there was prostate cancer, and they started looking at it carefully, and they started doing research. That's why our knowledge about prostate cancer comes mostly from that area.
So like in prior to World War I, was prostate cancer something that if you said to somebody on the sidewalk of London, do you know anybody with prostate cancer? They that person would know what you were talking about?
I would say no, it was not very well known. I think there were, people living with prostate cancer, but it was not detected. And maybe people were dying from prostate cancer without diagnosis.
Well, certainly people were dying from prostate cancer throughout history, I imagine. It's not, I mean, no one is laying claim, is saying that prostate cancer started as a environmental consequence. It was always like in the realm of like, you're a human being, so you have the potential to have prostate cancer and eventually die from it.
But there are some hypotheses saying that prostate cancer and men, there is correlation between these two, and men started to develop prostate cancer after a certain time in the history. There is a hypothesis saying that after the human in general, they switched their diet in the history, because of the diet, which helped body produce more androgen, which is sex hormone, which develops prostate and makes helps is important in prostate cancer development. So that's one theory. And also, to prove that, or just to give extra evidence for that hypothesis, they also looked at prostate cancer in dogs. So they figured out that almost at the same time in the history, dogs and prostate cancer started to develop prostate cancer. So that's why they somehow correlate these to the change in diets. And based on the study that we published in 2016 about the history of prostate cancer in skeletal remains and mummies, based on that very little evidence, we can say that yes, that may be true, because the earliest reported and found prostate cancer in men was from 3,000 years ago, when it was around the time that the change in diets happened in the history of human.
Yeah, and perhaps, I mean, Industrial Revolution had something as well with the, environmentally as well as diet and perhaps even stress levels, the change from agrarian society, primarily agrarian society, and the society that existed in wartime to where you had urban dwellers working in factories and,
Mhm.
excuse me, and under weird conditions. By the way, it's worth mentioning that prostate cancer prostates exist in all animals with vertebrae. I mean, dogs, cats, lions, tigers, gorillas, sheep, and whoever else you sort of keep as a pet in your backyard.
And my knowledge about prostate cancer treatment, I know generally, surgery, radical prostatectomy, which again started maybe between 50 or 60 years ago. And then, they started androgen deprivation therapy, which is, just to block androgen, which is a sex hormone, in order to stop or try to stop, the development or the progression of prostate cancer, also radiation. So these are generally, my knowledge about that, but I would refer it to a urologist or, radiation oncologist who are really expert in this field.
Yeah, and Google as well.
Yeah,
We're,
absolutely.
I mean, we had World War I, we had the Crimea War, which meant we had lots of bodies to dissect, around, the 1910s or 1890s through 1920s, let's say. So lots of dissections occurring and lots of opportunity to feel for lumps and bumps on all internal organs, including the prostate. And at some point, some anatomist or physician or scientist would have said to themselves, there's a lump here. I bet this person, if they didn't get blown up by a cannon, they would have died from this cancer. Perhaps there's a way to cut this thing out, or to use an early form of radiation therapy to burn it out. Do you have anything to color our understanding of that?
Yeah, I agree with what you said, and also I would add that, especially, years ago, many years ago, when people, so people with prostate cancer may have some symptoms from like urinary symptoms. So when it is an advanced disease, it blocks the urethra, and people may have symptoms like BPH, which is benign prostatic hyperplasia nowadays. But in those times, they were not really able to distinguish between these two. And also, in advanced disease, if prostate cancer, starts to metastasize, then patients probably they had other bumps in any part of their body from prostate cancer, or metastasis to bones, to spine. So they may have like back pain or any pain in the bones. So yeah, people were symptomatic, but later, at the range of the disease, probably.
Right. When did people understand that things metastasize?
And definitely after our understanding of molecular biology and molecular tests started to develop, and then they could get biopsy from those distant areas and look at, under microscope, and then correlate with prostate cancer, with prostate gland. So that was the first, I would say, understanding of, metastasis from prostate cancer.
Okay. All right. Now let's get into the really meaty part of our conversation, which is like modern, modern meaning like the last 60 to 70 years of treatment and how it evolved.
But I know, I would say it was done at the more, modern prostatectomy. I know Johns Hopkins University and hospital, they performed there. But based on the history, probably in England, they started doing surgery on the belly for other reason, but because of the extent of the disease, they went down into the pelvic area, and they, cut out the prostate. So I would say the prostate surgery was done around 80th century, probably, or 90th century. Not necessarily for the prostate itself, but they opened up the belly and they went down. But the modern and, I would say, pure prostatectomy was maybe around in the 20th century, around maybe 1920s.
So let's talk about the first surgery at Johns Hopkins and how they even came about doing it.
So my understanding from prostate cancer surgery at Johns Hopkins was it was a difficult surgery, but based on their experience in urologic diseases, they were able and they were successful in performing that. So it was through abdomen, the lower part of the abdomen, they were just opening up, and I assume it was a very difficult procedure because the pelvic area is is very small area. It's difficult to manipulate the area, and so it was very challenging. And also because of the extent of the surgery, people and men after this kind of surgery were had problems with impotence and with fertility issues, because they were also cutting the nerves and nerves in that area, which is responsible for the fertility and for ejaculation and erection. That's why they started working on that, how to modify this surgery. And then they came up, especially Dr. Patrick Walsh came up with a technique of nerve sparing radical prostatectomy, which is in this surgery, so what Dr. Walsh did was he recognized the area which is full of nerves, and which calls nerve bundle. So by keeping that away of the area of surgery, he and his team was able to modify this type of surgery in order to give men better option for surgery of the prostate.
Yeah. And it sort of illustrates the importance of visualization, of understanding anatomy, and really having just a good visuals, a hand-eye coordination of where to place your instrument relative to important things that you may not see, but are there, kind of thing.
Yeah, and also, I know Dr. Patrick Walsh always say that if you want to, create something, if you want to make an innovation just in the medical field, listen to your patients. I believe what he did, he listened to his patients after maybe the first, cases of radical prostatectomy, and he recognized what they have or what complication they had after the initial type of surgery. And as you said, he had a creative mind, tried to fix the problem, and by visualization and just trying to know the anatomy better.
I mean, the idea of listening to your patients sounds so obvious, sounds so intuitive, and yet few people, or I mean, you may be listening, but your ears aren't conveying the information to your brain and your heart, and then you do something with it. He did, and
Yeah.
that was very cool. The evolution towards robotic surgery, what's the whole point of all this?
So the whole point of robotic surgery is, this technique gives the surgeon many options. The surgeon is able to, have control over his hand motion, and robotic surgery gives, chance and opportunity to the surgeon to operate in a very small area. And, that's why they use robotic surgery for prostate cancer treatment, prostatectomy, because as I said, that pelvic area is very small, it's tiny, it's as tiny as even if you want to do it manual surgery, the hands really cannot go inside the pelvic area. And after manual and radical prostatectomy, they started doing with laparoscopic technique, but again that was not really successful compared to robotic surgery, because again manipulation and using the arms of the laparoscopic device is not really easy to use. But with robotic surgery, having better control over the hand motion and being able to make small cuts.
So we have surgery, we've refined it to a point where even you could dampen a surgeon's tremors or coughs. You could really get hyper precise with surgery. Why does radiation therapy exist alongside surgery as a treatment option?
Yeah, so prostate cancer it starts within the prostate gland, but it may go distant. I mean, it may go to the other areas, first into the local area, beyond the prostate gland, and then it can go, into the other areas, which is called metastasis. So by doing surgery, the surgeons and the urologists are able to extract and cut out the prostate gland with the seminal vesicles, which are two, other parts attached to the prostate. But they're not really able to go beyond that, because that area is really tricky. Bladder is there, and there are many nerves and arteries, so they should be very confined to the prostate gland. But that's why what they do is, after they do surgery, they start, monitoring the patients to see if their PSA level, stops or is at the minimum, or it goes up. So when it goes up, it means that there are prostate cancer cells which already are outside the prostate gland, and the surgery just removed the prostate. But those prostate cancer cells are maybe in the local area, which, obviously these are at the level of cells, cannot be seen, but they start, growing, they start making PSA, men just produce androgen. And by androgen, prostate cancer cell is there. So if there is no other treatment, the prostate cancer will develop again, which is called recurrence. So that's why, radiation comes handy at this level, because by doing radiation, they just radiate the area, the surrounding area next to the prostate gland, in order to just kill the prostate cancer cells.
But did they, in a historical perspective, did people who were radiation oncologists and radiologists and such, is that what they started out thinking? Like, you surgeons, you're not cutting out, you're cutting out a prostate, but we know there are other cells somewhere. Our field will take care of those cells? Or was it just some, competition, and they had these machines, they wanted to use them, and they thought, let's use them on prostates too?
Yeah, so I assume in the history, when the scientists, invented the X-ray, and they had this knowledge of using X-ray for treatment, not only to see through the body for, diagnosis, but also they can use it for treatment. So they started treating, bumps, or, probably mostly there were cancers, which are palpable, which can be palpated. And, they started, developing this radiation treatment into other cancers throughout the body. And, prostate cancer is one of them. And again, at the beginning, because of the difficulty and, the prostatectomy, radical prostatectomy initially was very challenging procedure. So I'm sure radiation treatment was more successful and much easier than surgery in those times, because they don't have to cut the skin, they don't have to just come with very significant complications such as bleeding. So that's why they started using radiation. But after radical prostatectomy, they found how to modify that by doing nerve sparing surgery. Radiation therapy, is as a complementary to the surgery. But also in some patients, they still, if the prostate cancer is in advanced stages, just removing prostate cancer wouldn't help. It would just add extra burden to the patient. So that's why they specifically use radiation treatment in such patients.
As we close this out, let's get into androgen deprivation. Yeah, very interesting. Let's talk. So when did doctors start looking at, chemical castration as an opportunity for treating prostate cancer?
So just going back to the previous topic that about radiation therapy. So any kind of treatment has its side effect and complications. So especially nowadays, they have many other techniques just to limit and focus the area of radiation therapy to the prostate gland area. But initially, radiation therapy they were using the very, a broad range of the body to radiate. That's why people had many complications from radiation itself, because radiation not only kills cancer cells, but also they may kill the normal cells in the body, especially the colon, the bowel is in that area, and radiation into the bowel cells may, the patient may start to having diarrhea or bleeding. So these are some complications which were very frequent initially, but these days, because of the techniques and other devices, the complications are much better controlled. And going back to androgen deprivation therapy, so the chemicals, they started again 50, 60 years ago, after pharmaceutical companies started to understand how to make pills, or had developments, advances. But before that, the androgen deprivation therapy was through cutting out the testicles, which is called orchiectomy. So this is the simplest way of getting rid of the source of the androgen in the body. So these days, they don't really do orchiectomy for androgen deprivation therapy because of lots of medications that there are on the market. But yeah, at the beginning, surgeons were doing another surgery just for androgen deprivation.
Right. And did patients understand that as if they were being turned into a eunuch?
Yes.
Yeah.
Yeah.
Right. And it also sort of ran parallel to the 1940s and 50s use of both medications and orchiectomies to punish gay people, gay men, and to sort of control populations from breeding, I can't think of a better word than that at this moment. Certainly, like Native American First People in Canada were subject to, they were told they were, a surgery that would have health benefits, along with hysterectomies for women, as a means of just controlling populations, and effect genocide kind of things. So here we are, like in the early 2020s, 2021 going into 2022. So what's on offer with your work, with your colleagues' work? What do you think is going to be something that prostate cancer patients are just going to be super excited about?
Yeah, I would say that advances in detection and diagnosis of prostate cancer is, I think, we expect to see very huge advancements in that area. These days, MRI really works well. It is super helpful for detecting prostate cancer. But radiologists and those who are involved in the field of radiology, they're working on the scoring system to have better idea, to have better understanding of prostate cancer in radiology, and also come with plans to detect prostate cancer earlier as possible. And also in terms of treatment, personally, I don't think for prostatectomy or surgical techniques, there might be like other huge changes. But in terms of medications, medications with less side effects definitely, are under studies, and we expect to see, better medications with, and also for radiation therapy. As I said, radiation therapy also has some side effects. So I know there are devices just to protect bowel from the radiation when they focus on prostate gland area, but we should expect better devices for patients who they're in advanced stages of prostate cancer and they need radiation therapy. So they should expect to see better devices to have less complication.
But
Mhm.
patients will say that of anything. Tell me what, if you don't mind, what you're working on.
So right now I'm a little aside from prostate cancer. I'm doing research on liver cancer. And yeah, we have a database. We are working on those in order to how to detect the liver cancer based on MRI. And we are just trying to correlate our findings on MRI with the pathology under microscope. So this is interesting field. It is, cancer field is really intriguing. There are many advances in the field, and what I believe is any progress, let's say for liver cancer treatment or liver cancer diagnosis would help with diagnosis and treatment of prostate cancer, especially in terms of radiology and detection.
Yeah, I mean, there are multiple holy grails to be found, but one would be substituting or denigrating biopsy with the favoring imaging, MRI or PET, PSMA, whatever can sort of look into the body and describe things with either more, utility than biopsy would be super. So yeah, it's worth our audience knowing that prostate cancer is not the only, solid tumor where that's an issue. So good. This is totally grateful for your time today. Thank you for the work that you're doing and welcome to Mailcare's faculty.
Thank you so much for your time.